Good afternoon, friends. I'm so happy that you came to see us today. It is our regular Tuesday with the family team at the St. Louis Ark, and I've got a wonderful guest with me today, Julia Schaffner, who I probably won't ask her to give her illustrious history at the Ark because we've cut this to 30 minutes, and that might take 30 minutes because Julia has been with us in so many roles. But today she's here to talk about prevention services specifically related to alcohol and pregnancy. Julia, hi, how are you this afternoon?
I'm doing well, Sharon. Thank you for having me. I do appreciate it.
I'm so happy to have you here. I want you to tell everybody a little bit about yourself, but will you include in that kind of how you got involved in prevention work as an employee at the ARC?
Sure. I had been a fairly long-term employee at the time when we received a grant to be able to expand our prevention efforts to include a fairly significant amount of outreach to teens and young adults. And we did that through guest presentations in school districts, mostly high schools, some middle schools, and some post-secondary education, colleges, universities, etc. So that was my first introduction into really diving deeper into the issues that are caused by prenatal alcohol exposure.
And that's really what we're talking about when we talk about prevention.
It is, yes. So obviously prevention is a huge term, but here at the ARC, our prevention efforts are really revolving around educating people about those harmful effects the effects caused by prenatal alcohol exposure. So when alcohol is used during a pregnancy, it is actually a teratogen, a toxic substance to developing fetal tissue. And alcohol use during pregnancy is considered one of the leading preventable causes of developmental disabilities. So that is kind of the key here, is it is a preventable cause. So our passion is to get education out to people so that they can make good choices, healthy choices going into a pregnancy or while they are pregnant. So the Go the Whole 9 program is what we have called our prevention efforts. And it really consists of a campaign designed to raise awareness. It is a media campaign. So we advertise in various venues. We do social media advertising, static advertising, and then we also do educational outreach to groups all over the greater St. Louis metropolitan area. Obviously, that outreach has looked a little different in the last year and a half, but we are, as events and activities open back up, we are hoping to be able to resume more of those opportunities where we are actually going out and interfacing with the public, one-on-one, small groups, large groups, whatever, to really help them understand all of the issues related to alcohol use in pregnancy.
So it sounds like, how long has the Go the Whole 9 campaign been going now, Julia?
Yeah, it has been, you know me, I am terrible with dates and tracking of time. It is not my strength. But we have been going since about 2009. So we had prevention efforts, as I mentioned, long before that. So the ARC itself has been committed to prevention efforts of some sort it's been 25 years plus, I believe. But Go the Whole 9 was, so our prevention efforts were kind of rebranded to this Go the Whole 9 campaign in about 2009. And that coincided we launched Go the Whole 9 in September, which is known as International FASD Awareness Month. In 2009, having special significance because of the 9.
So 999. So
yes.
the 9 has to do with 9 months of pregnancy. So I'm going to just go ahead and ask you to talk about your messaging in the Go the Whole Nine campaign, because there's very specific messages that you want to share with the public. What are those?
Yes, yes. So there is no amount of alcohol that has ever been proven to be safe to use during a pregnancy. So zero, none has ever been proven to be safe. One of our goals through the Goal the Whole Nine campaign is to distribute factual information. So as everyone knows, you can go on the web and pull up all sorts of information, but our messaging is consistent with the Centers for Disease Control, all of the major medical associations, et cetera. So this is factual information that we have to date from scientific research. So messaging, basically no amount of any type of alcohol is safe to use anytime during a pregnancy. So I stress type because there are so many myths out there about wine, particularly red wine. I know I hear repeatedly from people that I talk with that they were either told or thought that wine was okay to use during a pregnancy, like if it was consumed with a meal. But wine is alcohol, and the developing fetus doesn't have the ability to differentiate whether that alcohol came from wine, beer, hard liquor, etc. All alcohol is potentially damaging to the developing baby.
So I want us to clarify for people that that doesn't necessarily mean that if you have a drink at any point in your pregnancy, that your child will develop a developmental disability. It's just that we're just not sure when it could happen. Is that correct?
That is correct. And what we know about alcohol in pregnancy is that the more alcohol that is used, the more frequently alcohol is used, the higher the risk. Just like smoking in pregnancy. So we've known that smoking during pregnancy is a leading preventable cause of neonatal death. We've known that for a long time. And people pretty much understand that smoking is not healthy during pregnancy. But at the same time, we probably all know people who smoked during a pregnancy and their babies were born full term and a healthy birth weight. However, we may also know people who smoked during a pregnancy and maybe their babies were born prematurely, had health issues, very low birth weight, etc. So there's always a chance that there could be a negative impact from the alcohol, but it does not happen every time.
I think this is one of those super tricky areas because so many people don't even know when they're pregnant right away. And so I think that there's a lot of people that are fearful when they hear that you could have exposed your baby to alcohol and there could be problems. How do you approach that empathetically so that people can hear the message, but maybe not shut it off because they're afraid that they've maybe caused harm?
Sure. And you bring up a really great point. It is so unfortunate that damage can happen before anyone even knows a pregnancy exists. So the good news is that we know the sooner the person stops drinking, the sooner the person stops using, the less likely there is to be any sort of damage. And when we think about it, actually that impact of alcohol, alcohol is most likely to affect the developing brain tissue. So that's the part of the body that is most likely to be affected. There can be effects in other areas also. But what could happen from maybe, a drink or two before the woman realizes that she's pregnant, it could be maybe the difference of an IQ point or two, right? Like that's nothing that anybody is going to ever really know. And so, what we want to tell people is you're not alone, right? This happens frequently. This happens very frequently. And once we have the information, once we're equipped with information, then it becomes our responsibility to make good choices from there on out. So that's one reason we are very committed to getting this information into the hands of people before they're pregnant so that they can know that information going in. We know that, right, there's nothing we can do to change the past. And it's never too late to stop. That's the good news. It's never too late to stop. And in the state of Missouri and in most states, a woman who is pregnant, who is seeking out assistance to overcome some kind of substance use disorder or struggling with stopping, should be given precedence over anyone else within an inpatient or outpatient setting.
Good to know.
Yeah.
Okay, so I think this might be a good time. I want to ask you about some of the ways you do outreach, and I know that you would like to share the Go the Whole Nine website with us. Can we share that with the audience and just show them a little bit about what you can find when you go and check out whole9.com?
Yes. Okay.
Oh, it's whole9.org.
.org, yes. So one thing that gets a little confusing for people is that the Go the Whole Nine program is a program operated by the St. Louis ARC. So we are a program of the ARC. So and you can link to the ARC on here, but you're going to see this Go the Whole Nine. And if you scroll to the bottom, this is the ad that you will find out there in various venues. The ad consists of this website as well as a telephone number. You can learn more about Go the Whole Nine and learn the facts about alcohol and pregnancy on here. Our goal through this website, we cannot address every question. We cannot address every issue, but our goal through this website is really to help people link to resources where they can get more factual information.
While you're here, Julia, can you talk? I was going to talk about this next, but since you've got some resources here, the impact of an exposure that causes damage is a fetal alcohol spectrum disorder diagnosis potentially. And I know it's a very underdiagnosed disability. Can you talk a little bit about what that spectrum looks like?
Sure. So fetal alcohol spectrum disorder is actually taken after the term is taken after autism spectrum disorder. So we probably all know people who have an autism spectrum disorder, but their presentation is varied, right? So if you meet one person on the spectrum, it doesn't mean you know everybody on the spectrum. So everyone is unique. And so with fetal alcohol spectrum disorder, it's the same. So it means that there is a spectrum, there's a wide range of impact that can be caused by that prenatal alcohol exposure. A lot of that has to do with the amount of alcohol, timing, but also just factors that we don't even really know, the metabolism of the mom, the other health factors, other risk factors, etc. So under fetal alcohol spectrum disorder, that term means that there is some type of impact from prenatal alcohol exposure. So had the prenatal alcohol exposure not been there, the person would not be impacted. Okay, so that's kind of a difference. So within or under that umbrella of fetal alcohol spectrum disorder, there are various diagnoses. The most common that people are familiar with is fetal alcohol spectrum disorder. So fetal alcohol spectrum disorder, often abbreviated FASD, is a medical diagnosis that constitutes damage in 3 different areas. So that includes some differences in facial features caused by the alcohol, poor growth, low birth weight, being small, usually throughout childhood at least. And then also some sort of central nervous system damage of some sort. So there has to be like a certain timing and amount of alcohol to affect the growth and the facial features. But the brain development, so we know we know that fetal development tissue is sensitive to the effects of the alcohol, any teratogen, alcohol is a teratogen, when it is developing. And the brain, the fetal brain tissue is developing through the entire pregnancy. So what that means is that the brain is susceptible to damage anytime alcohol is used. And that is why FASD typically constitutes some kind of difference in brain development. One issue I want to point out is that because the brain is the most likely to be affected and the physical features associated with alcohol are the least likely to be affected, it is often referred to as an invisible disability. And if something is invisible, people don't see it and they don't understand. People with FASD may have like an average or maybe slightly below average IQ or even above average IQ. So the IQ of the person is not always affected. And so much in our society rides on IQ testing, but adaptive skills. So just being able to make decisions and process through relationships and understand right from wrong and understand when you're being taken advantage of. Those are really the areas that people with FASD frequently struggle the most with.
That was an outstanding overview. Thank you very much. And I do think because it is an invisible disability, we do like to just bring it up to people that it's very underdiagnosed. So if you have certain characteristics and you're feeling like, that whatever the diagnosis you have, maybe it's not quite accurate or you're not getting your support needs met, it can be really difficult to go back and get an accurate diagnosis. How do they do that, Julia? Is there somebody here that does an FAS assessment?
Yes, there is a doctor at St. Louis University, at Cardinal Glennon, and he is in the genetics, Dr. Braddock, who is trained on doing the assessment and the testing for FAS. Unfortunately, FAS is not, and fetal alcohol spectrum disorders, there's no blood test that can be done, which also makes it terribly difficult to diagnose. And what we find is that people who have a fetal alcohol spectrum disorder are often misdiagnosed, or maybe their co-occurring struggles receive a diagnosis. So for example, ADHD is a very, very common co-occurring diagnosis. And so the ADHD may be caught, but there may be some additional struggles that person has that are maybe going to go undiagnosed. So when we know that it is fetal alcohol spectrum disorder, we understand, or we can reframe, we can put a different sort of lens to what that person is experiencing, and approach them with an empathy that we may not otherwise. So, and providers of all sorts, educators, parents, etc. If we know that, and if we understand that the behavioral characteristics that the person is exhibiting are related to how their brain developed related to that alcohol that was completely beyond their control, and what they're doing is not intentional, then we can support them in a much more positive manner. And we know that the outcomes then are more positive in the long run for that person. So other common co-occurring diagnoses or things, this would be when a person gets a little bit older, would be things like depression and anxiety. And that is often related to folks not understanding, often well-meaning, loving folks who just don't understand why the person is maybe struggling to retain information, why they continually make the same mistakes, and why they have trouble like thinking through different events.
I love that. I mean, I don't love that that's happening, but I love that we know, I think so many wonder why is it important to get a diagnosis, and in a lot of cases it just might not make that much difference. But I know in the case of fetal alcohol spectrum disorders that there are very specific strategies to give people the best support that they need. And when you see someone that's had the proper support over the years and see the success that they've been able to have, it's really makes it important to make sure that other people realize that there are other ways to approach what can be a really frustrating situations. Thank you for a really great overview. I don't want to miss the other tabs on the website. So go ahead and let us know what else we can answer.
I'm sorry. Yes. So this part is all about learning about FASD. Get help. So we have resources. These are resources if you know somebody or love somebody who might be affected, as well as how to find resources to stop drinking. And then living with FASD. So this would be for people who are affected or family members, and then for education providers, educators, and other providers. We have on our website the ability to promise to be alcohol free during pregnancy, and also to support others to be alcohol free. And so this would be giving people information, like passing along information. So we don't know what we don't know. And so if I am a person that has never had exposure to this information, then I'm relying upon those within my circle or even outside of my circle to let me know and to provide that information to me. So what we encourage people to do is to take this information and then pass it along to others. We have about us. So this just talks a little bit about the history of Go the Whole Nine. And you can also link to the ARC on here, and then our contact page. Please feel free to, for anyone watching this, please feel free to pass this website along, link this website to anyone that you think might need the information. When we are out in public and doing public outreach and presentations, we have materials that we're able to leave behind so that people can access this information and pass it along to other people too.
Thank you, Julia. Let's talk just a little bit about some of the other ways you do outreach. You've got the website, but I know you've got a whole tab for educators. Do you go and do classroom presentations?
Right. So we can do that. We don't have the capacity to be able to do it like we used to, just because of some funding constraints. But we can go and do classes. We can do childbirth classes. We've done those. We do outreach with various health centers and back to school events, basically anywhere where people are gathered and are interested in the information, we can make that happen. I've done church groups, youth groups, etc.
Excellent. I just think it's so important. And I've really enjoyed over the years being able to see the outreach in high school settings and colleges and in some of those other community locations where we're getting the word out to people. So I do think it's so important. All
Yeah.
right, let's go ahead and do you want to share anything else about the website?
No, I think that's all.
All right, so everybody go out and take the pledge and know that this is a resource for you if you need more information. Julia, I guess I want to make sure you have a few minutes to talk about what you want to make sure you get out to the
Yeah.
audience.
Yeah. So one of the questions I get asked a lot is, does this or implied is that, oh, this is something that only happens to certain segments of the population or only happens to people who are addicted to alcohol or struggle with any kind of substance use disorders. And that's not true. This is something that cuts across every ethnic, racial category, every socioeconomic category, every part of the region. This is a real issue that everyone needs education on. It doesn't matter who you are. If you use alcohol and if you are going to become pregnant or could become pregnant, then this is something you need to know. And if you are the partner of someone who uses alcohol and could become pregnant, this is something you need to know. So I always really encourage parents to let their children know what constitutes healthy pregnancy practices while their children are young. We know that kids who grow up understanding what healthy practices are more likely to implement them later on. And again, last thing we want people to do is to beat themselves up if they did use alcohol during a pregnancy. We have, there are support groups, there are like birth mother support groups that are out there. There's a new support group in the state of Missouri that is designed for caregivers, any type of caregiver. It's a statewide and it's a virtual platform, so anyone can join, and they can just reach out to me directly and I can get that information to folks. There's a lot of really great information these days that is available on best practices. You were talking about that. And what I really love about the best practices is they don't hurt. They are not punitive in any way. And so even if someone just is suspicious that there may be some damage from prenatal alcohol exposure, they can implement those practices and there will be no trauma inflicted. So they're very supportive practices. I want to also end by saying that there probably more people are affected than we ever realized. So we used to say 10 years ago, we used to say about 1 of every 500 or as many as 1 of every 500 children born will be impacted. Now we're thinking it's probably more like 1 out of every 20 will be impacted. And again, that can be mild effects, but that could also be pretty significant effects.
Well, that doesn't really surprise me because I was reading some research the other day about the increase in binge drinking in women.
Yes.
And what's considered binge drinking was a little eye-opening to me because it was like more than 2 drinks within a certain time frame. And I thought, oh, that is a much more restricted number than I had realized. So if you're going to engage in drinking at all, and then you're in binge drinking, it makes sense that those same behaviors will translate this way. So
Yes.
I'm really happy that we're spending the energy to get the time out. Who pays for you to do this work, Julia?
Yes, thank you for for asking that. The Department of Behavioral Health, part of the Department of Mental Health, they are the funders for this particular program, and we appreciate their continued support of us and continued support to get this information out.
I hope that we're this would probably be another whole conversation, but I'd like to think that we're getting to physician training programs because I think there's been some misinformation for doctors too.
Right, right. Yeah, I want to just say that every major medical association out there uses that same terminology, that no amount of any type of alcohol is safe to use, and physicians should be doing screenings on their patients, particularly those of childbearing age.
Awesome. All right. Well, we've come to the end of our time frame. Thank you so much for a super
Right.
informative half hour. And
Thank
hopefully
you.
we'll have a chance to catch up again on this subject or one of the other many things that Julia is involved in at the St. Louis Arc. Thanks for coming and joining us today, everybody, and have a wonderful rest of your day.
Thank you.